Today's Talk365TV's Talking Wellness segment is presented by Brain Rehab Clinic.
Welcome back, everybody. Today we are talking wellness with Dr. Hatch from Brain Rehab Clinic, and specifically we are talking about a really rare condition called misophonia. Now, have you ever heard of this before I started talking with you about it?
No, and it's just kind of shocking, but it's basically the brain not being wired right.
Yeah, it's a very new diagnosis. I think for a long time people just thought these were people being, a little out of control or maybe a little touchy, because it has to do with noise. So like chewing, crunching, but the most interesting thing is, like when a bird flies by or something flies by your head, your instinct is to instantly move. It's not like you make a rational decision, like I'm going to move away from what's flying at my head.
It's very primal. You just boom.
Yes, it's the part of your brain you have no control over that kicks in. Well, people who have misophonia, it's rage. And Dr. Hatch fell into it, and he tells the story of how basically misophonia founded him, and then what causes it, what's going on in the brain, because he spent the last few years, at least the last year solid, really studying not only what is happening in the brain, but testing exercises that can help people alleviate the symptoms and move on with their life. So he's actually a leader in the whole area because not very many doctors treat this on the planet.
What would be very frustrating is to have a condition like this and not have people know what it is, not having medical science behind it, So in other words, when you get sick, when you get the flu, everyone knows. It would be very difficult to have something where no one knows.
Nobody understands.
And your reaction is very antisocial.
Yep. So
that's the worst thing.
Kelly Ripa has it. And Kelly Osbourne has it. There's a number of celebrities. Kelly went on a 2020 interview and was talking about it. And that's what she was talking about, is before she understood that there was an actual neurological problem, she's like, I just felt like the Hulk. I felt like a horrible person because she'd hear a noise and just want to go crazy.
Tourette syndrome like.
Yeah, they triggered into rage a lot. And think about having kids. Dr. Hatch brings up going on vacations. Like you have to have separate vacations almost. And a lot of these children get to a point where they almost have to live in a separate quarter. There's a few of his patients that I know have built casitas in the backyard where basically the child lives, or the mom or the dad, if that's the trigger noise, like their voice can sometimes be a trigger. Sometimes that person lives in the other area so that they can not trigger the child off. I mean, it is just a life-altering condition that Dr. Hatch has figured out, and that he has some awesome exercises that can help alleviate the symptoms. And we have sat him down. This is going to be a 2-part interview, so get comfy. This is part 1 of our chat with Dr. Hatch from Brain Rehab Clinic about misophonia. Here you go.
Talk365TV's Talking Wellness is brought to you by Brain Rehab Clinic with wellness team expert Dr. John Hatch.
Hey everybody, it's Holly Love, and today I am back at the Brain Rehab Clinic with Dr. John Hatch. Dr. Hatch, how are you?
I'm doing so good. Thanks for being here.
Thank you for letting us come down. I am so excited about this interview. We have something very special happening today because Dr. Hatch is one of a few doctors globally that treat a condition called misophonia. It's very rare, but people who suffer with it, it's a lot of problems, pain, suffering. It is a life-ruining condition. And Dr. Hatch not only has figured out how to correctly diagnose, treat, and greatly reduce the symptoms, but become really a leader and an expert in this field, an innovator as far as the way that you're doing it. And so today I'm excited to announce that not only is he going to explain how he came about knowing this information, he's going to share some tips and some exercises on ways that if you're struggling with misophonia, by the end of this thing you are going to be able to greatly reduce some of the symptoms you're experiencing by learning some of the exercises as well as learning more about the condition. So Dr. Hatch, without further ado, let's dive in and let's start by how did you find this disease? How did it find you? And how did you develop this protocol that is working so well?
Yeah, it definitely found me.
Yeah.
It wasn't something I had even heard about a year ago. A dear patient had walked in and said, my daughter suffers from misophonia. I hadn't known what that was, and so I said,
oh, wow.
What is she dealing with? And basically most misophonia is diagnosed with an inability to take the sound of chewing. It's mouth noises, nasal noises, sneezing, coughing, slurping, and it creates a reaction in them that's aggressive or very annoyed by a sound, sometimes even into anger. And so children are isolating themselves, they're dropping out of school, parents have to do homeschooling. Worst case, sometimes the parents have to put that child in its own room and the child isolates themselves. They don't eat with their family, they don't eat outside. Everything is catered, even vacations. Imagine going on a vacation on a 3 to 6 mile drive and no one in the car can eat. And then when they get out, it's everyone go in different directions, eat your food, and then come back and get in the car because one child, or maybe two, are suffering from a reaction or the illness of misophonia.
And this isn't just being bothered by somebody who's a loud chewer.
No.
This is where they have a reaction similar to having an anxiety attack or a panic attack, and then like you said, which can lead to rage where it's an outburst, which I imagine with smaller, younger children would be incredibly hard to go in public because there's no rationalizing or reasoning with them. Maybe the older ones, it's something they can't even control though, let alone the younger ones, right?
Absolutely.
So those are some of the symptoms that you experience when you have misophonia. What is the cause? What's happening?
So that's been the great thing to discover and figure out, is right now research on it, it's so new. It's only been started or coined the phrase misophonia for the last few years. Prior to that, no one knew what it was. They thought it was just someone who had oversensitive to sound. But prior to that, they weren't sure what was happening, what was going. Now, new research shows that there's a combination of dysautonomia with a negative emotional wiring. And we're trying to juggle the two, and that's what all the research has been showing is, do you do this, do you do this? Do you do this first and then this? Well, what I started doing is looking at how is this brain working and what are the parts of the brain that are involved with everything that's going on. Not just a single segment, but all of it. And so with the very first patient that came in, I simply said, let's talk neurology and let's understand what is going on in the cortex. So we drew out the patterns of where sound travels and how you interact it and where the negative emotion is. And I looked at it and it was just like a light bulb. This is the area of the brain that's not working, and now how do I change it? And so that's what's fun is here at the clinic we can do a bunch of diagnostic tests to find areas that run through that pathway of the brain, and if we can change it, if we can see the findings and then make changes to those findings and see that outcome, we watch their symptoms reduce over time. And it's been incredible, humbling, and amazing for those that have seen the changes.
Brain Rehab Clinic is proud to announce that they're the first clinic in Utah to have on-site the gyrostem. And welcome back to Talk 365. One of the things that I'm learning now is that you have a malady, but that everyone's different. And that's a challenge. So, you know, if you get the flu or pneumonia, you know that antibiotics work for everyone.
With the brain, there's a little bit of variations with everybody. Obviously, widespread if you're struggling with all kinds of different conditions that Dr. Hatch can treat, like, you know, anxiety, depression, autism, learning disabilities, all of those things. But when it comes to misophonia, he's really figured it out. And he has found 3 exercises that he's clinically tested for the last year. It helps across the board people who are suffering with misophonia because of the way he's figured out that misophonia is happening in the brain almost every single time. So we have one coming at you right now that he's going to be giving away. But if you want all 3, you're going to have to log onto his website and subscribe and get full extended interview webinar from Dr. Hatch, which writing it out and showing exactly what happens to these people when they hear a noise and how it travels through the brain and where it reacts and where it goes wrong, where it misfires, and why and how his protocols and treatments are so powerful and why they work. So without further ado, here is our part 2 of our interview with Dr. Hatch at Brain Rehab Clinic, where he talks about how to do exercises to alleviate symptoms from misophonia. Here you go. Let's dive in and talk about one of the 3 that you feel like could help people suffering right now.
So one exercise I'd really like to share with people, because this has made some big changes in people's brain and it's something that I've learned and kind of tweaked to my own little findings from other doctors, is called vertical slingshot saccades. So vertical slingshot saccades are done with 2 targets, one at the nose level, one at about 6 to 8 inches below. And your head is going to move down while maintaining your eyes on this target. And then when your head stops, then you look at the bottom target. Hold your eyes on that target, bring the head back to neutral, then look at the top target. What's happening in this exercise is it's negating a reflex. The reflex of the brain is when I look down, we all look in the direction that our head's moving. So if I tip my head up, we look up. If I look to the right, my eyes look to the right. I don't look at you and go, hey, I'm gonna go this way.
Or look up and go down.
And look up and go.
I can't even do that.
Yep. If we want to go move our head down, our eyes will always want to look in the direction of which we're going. So it's your brain's conscious brain to negate the reflex. So with a vertical slingshot saccade, again, you're tipping your head down when your brain wants to look at this target. And when you start this, you'll end up looking multiple times. So just be patient, start slow. Slower is always better, but you just tip your head down till it stops, then look. Hold, tip your head back to neutral, then start.
And your eye is still looking. Does it matter which way you have your thumbs,
No.
or left, right, which one's on top?
Nope, two things are happening too. We're also bringing our head down. Head inflection drives the rubrospinal pathway, which will shut off the tectal reaction. And that's why we go from neutral to down versus neutral up. Because the moment I do this, I'm gonna go in that tectal reaction. So it's imperative that we start neutral, bring the head down, and then look, then bring the head back to neutral. Don't bring the head back, you'll trigger the reflex.
Wow.
This is how specific a brain exercise can be.
So possibly having somebody watch you do the exercise, because being in a tactile response, which in layman's terms mean your balance is back here in some way. So like he just said, if your head is even going back because that's a habit and that feels normal to you, you probably don't know it. So a neutral head is centered, yes? And then again, starting here, moving the head to here, and then the eyes.
And
starting
making sure
here.
the targets are directly in line with each other.
Oh, that was key.
It's very important. So that's why you can put two
Not
targets.
my thumbnails.
Yep, you could put two
my
targets on the
thumbs.
wall if you needed to.
Okay. So how many times should they do that? How often during the day? Because not always just doing it when they're having a response, right? Or symptoms.
Yep.
What is your regimen?
We usually look at brain therapy, specific brain therapy like that, 15 to 20 minutes max in a day. So we look at that simple exercise. I usually do it for about 10 times, which going slow is about a minute to 30 seconds, and getting that in somewhere between 3 and 5 times. We start slow and we build up. If we're noticing we've been doing the exercises for 2 to 3 weeks and we're not getting enough change, we can increase the number of times we do it in a day.
Okay, so a gradual increase,
Yes.
and you can't do it too much?
You can if you exceed that 15 minutes.
Okay, got it. There you go. That makes sense in there. So we are going to provide a longer web edition of this interview where we're going to keep Dr. Hatch and we're going to roll through the other 2 exercises. We're going to talk a little bit more about symptoms and treatments here at the clinic and ways to get a hold of him and ways to come in if you're from, another country, how it all works, the ins and the outs. But for right now, Dr. Hatch, thank you so much for your information. As always, I absolutely love coming down here. I love it the most because you help people who have run out of hope, who think there is nothing left. They've seen all their doctors. And if you're one of those people and you are suffering with something that is chronic, just think if he can help someone who is suffering with something this intense and this obscure, imagine what he could do for you. And for you having something else to figure out why it's happening, if that's what you want, this is your guy. So get in here to Brain Rehab Clinic. You have some amazing new equipment. The GyroStem is one of only a few pieces in the world, and we have one right here in Utah. And what is the best way for people to get a hold of you and book an appointment?
Go to brainrehabclinic.com. All the information's on the website there. And right now we're about a month, maybe 2 months out. We do get cancellations from time to time, and miracles happen and people get on the list when they're supposed to be here.
So call the Brain Rehab Clinic, log on to their website to learn more information, and if you want the rest of these exercises, check out the webinar of this interview where we're going to go long. But in the meantime, thank you so much for joining me once again, and don't go anywhere. We'll be right back on Talk365 TV right after this. Welcome back, everybody. That was our concluding interview with Dr. John Hatch, but that's not necessarily the end. If you are loving this content, if you are someone who suffers with misophonia, log on to their website, give them a call, make an appointment to get in there and utilize Dr. Hatch's extensive studies in this rare condition. But for immediate relief right now, do log on, get this webinar, and you can learn all 3 of the exercises that he has clinically tested for the last year so that you can have relief from some of your symptoms. It will help you, and he is just a force to be reckoned with in this area. Misophonia has become a specialty that came to him, and he adopted because he loves people and he just genuinely wants to help. So check that out, and thanks for joining us.